what percentage of chronic debilitating symptoms are alleviated with surgery or
None.
medication? None.
No. So surgery treats a symptom. The biggest factor keeping people in pain is anger. But I thought anxiety and anger were psychological constructs. It turns out it's just the sensations generated by your body when you're in fight or flight. So I quit my surgical practice in 2019 because I was so frustrated seeing so many people badly damaged by spine surgery. I'm seeing so many people go to pain-free with minimal cost, no risk process.
If you or someone you care about is struggling with long COVID or ME/CFS, you are in the right place. And you're about to hear one of the most eye-opening and information-packed conversations in the chronic illness space. Today, we're diving into what's actually driving chronic symptoms, not just physically, but mentally and emotionally. And spoiler, although it's not all in your head, which we always knew, it is deeply wired into your nervous system through something we'll be exploring right now called threat physiology. If you're new here, I'm Raelan Agle, and the conversations you will find here are like no other in the chronic illness space because we explore all paths to recovery. If it helps people heal, we talk about it. The goal is to learn together and help each other find a way out. And today, I'm thrilled to be joined by the incredible Dr. David Hanscom. He spent over 30 years as a complex spine surgeon until he realized he had to walk away from the operating room to help people truly heal from chronic pain. And his own 15-year journey with pain and many other symptoms led him to an unexpected discovery. Anxiety, looping thoughts, and unconscious stress patterns were actually at the root. And once he addressed those, he finally fully recovered. And now he teaches how to shift from threat to safety physiology, interrupt repetitive, unwanted thoughts, and work with the unconscious brain where most pain actually begins. And according to him and so many other respected professionals in this field, this approach works not just for chronic pain, but also for anxiety, depression, and yes, even ME/CFS and long COVID. So if you're stuck in fear loops, if your body feels like it's always on high alert, or if you're just exhausted from being told that there's nothing wrong with you, when you know that something is, my heart goes out to you, and this conversation is absolutely for you. So let's dive in. Dr. Hanscom, wonderful to have you here. Thanks for doing this.
Yeah, thank you. I'm excited to be here.
Oh my goodness, such a vast amount of knowledge and experience you have on this topic. I can't wait to get into all of this. I'm sure people would love to hear a little bit before we get into the details of all of this, just your journey. How did you end up doing this work that you're doing? What's your experience been leading up to today?
Well, I'll try to keep this story relatively short, but basically, I practiced complex spinal deformity surgery in Seattle, Washington for about 32 years. And about 4 years into my practice, around 1990, I was in Seattle, driving across the 520 bridge. And at the time, I was in my practice. I was a young gun, just going after it hard. And I didn't even know what the word anxiety was. You don't become a major spine surgeon by having anxiety. And also in the 520 bridge in Seattle, I had a panic attack. And I'm going, what is this? And I had to look it up. I didn't know what it was. And, it's basically a dysregulated nervous system. It's an ultimate anxiety reaction. And from that point on, for the next 13 or 14 years, I could not come out of this hole. So I developed 17 different symptoms of migraine headaches, itching scalp, skin rashes, back pain, neck pain, couldn't sleep, ringing in my ears. And my whole nervous system sort of fell apart, but nobody could tell me what was going on. So part of it, I went to counseling for like 13 years, psychotherapy, trying to figure this out, and things got even worse. And it wasn't until 2002, 2003, things got extremely bad that it sounds odd, but I sort of gave up fighting. I didn't know what else to do. And inadvertently, that turned out sort of to be the answer. Because what I eventually learned, that with the brain being so neuroplastic, whatever you're fighting and trying to fix actually becomes reinforced. So it turns out 13 years of psychotherapy was actually reinforcing the pain circuits, not helping them. So the bottom line is I came out of my all 17 symptoms around 2004. and I've been pretty much symptom-free for over 20 years. And I never thought this was possible. And I went into it by accident. I came out of it by accident. It took me about 20 years to figure out what happened. In the last 5 years, we've formed a scientific international study group that actually goes into the science of chronic illness. And now I actually know it, figured it out. But it's been about a 35-year quest to figure out what happened to me that day on the bridge.
And from all of your learning from what happened to you, how does this tie into your work as a spinal surgery and how you then proceeded to approach treating patients?
Well, I started out in internal medicine, so I instinctively had sort of a whole person approach right from the beginning. So I always see my patients a few times before surgery. I try to make sure they get physical therapy, medications, etc. But I was still a pretty aggressive surgeon, but a lot of the surgeries weren't working very well. So Seattle at the time I was there between around 1986 to 1995 was doing 9 times the rate of spine fusions per capita as any place else in the country. And so I was part of that team, and I was enthusiastic. I felt guilty if I could not find a reason to do surgery. And I started to think what I did, but basically it turns out we were operating on normally aging spines. The success rate of doing a spine fusion for back pain is about 20%. And it's a big operation, and I thought it was like 90%, but I knew my results weren't as good as I wanted them to be, and I got mine up to about 45%, but it wasn't because of the surgery, it's because of the rehab. So in 1993, when that paper came out, I just quit doing surgery for back pain, but I didn't know what to do. So in the meantime, I was spiraling into this deep hole of chronic pain and multiple symptoms. And so I just sort of did the best I could non-operatively. In 1999, I moved to Sun Valley, Idaho in a private practice, sole practice, and I didn't have any resources. So I had to start doing everything by myself, and I knew that there's some tools that worked. And long story short, I took a surgeon's approach to non-operative care. So it turns out that you address sleep as number one. If people weren't sleeping, we found out that lack of sleep out of a study in Israel, so that lack of sleep actually causes chronic low back pain, not the other way around. So right off the get-go, I'm going, oh, that's interesting. That's not so hard. But the data also showed only 5% of 5% of physicians were actually addressing sleep. So I started doing that. I handed out a little book called Feeling Good by David Burns, which is cognitive behavioral therapy. I didn't have a psychologist, and then David Burns started to do some expressive writing. So we started that. People started getting better. And I always did good physical therapy and rehab, so that was in place. I would stabilize medications. And then what came out really in a clear way was life outlook. So it's jumping ahead 20 years. It turned out that the biggest factor keeping people in pain is anger. But I thought anxiety and anger were psychological constructs. It turns out it's just the sensations generated by your body when you're in fight or flight. So when you feel anxious, your body says danger. So you have your fight or flight response starting. If you can't solve the danger, you can get more of a fight or flight response and you become angry. So it turns out anger and anxiety are physiological survival responses that we have no control over. Zero. And a friend of mine, Bruce Lipton, who is the author of the book Biology Believe, pointed out really clearly we have zero control out of anxiety and anger, and we now call it threat physiology. And so anxiety is activated threat physiology, anger is hyperactivated threat physiology. And the problem with threat physiology, your entire system fires up. So your neurotransmitters in the brain go from calming to excitatory. Your stress hormones, of course, kick into place. There's a little molecule in the bottle called cytokines, as you well know, the little molecules that go from cell to cell. And there's anti-inflammatory ones and pro-inflammatory ones. And under fight or flight, your entire immune system lights up. And then cortisol drains fuel out of your body. It's been known for 50 years that chronic stress breaks down the body, i.e. chronic fight or flight. So any athlete has to train, then rest in order to regenerate. If you're in constant stress, fight, or flight, your body breaks down. It turns out that every chronic disease, with few exceptions, are related to chronic stress. That's mental and physical diseases. So it turns out that anxiety, depression, bipolar, OCD, and schizophrenia are basically metabolic inflammatory disorders. The reason it's so critical is that this physiological response is about 500,000 times stronger than your conscious brain. So your unconscious brain processes about 11 million bits of information per second. Take a guess how much your conscious brain processes.
I couldn't begin to imagine.
40. So what were happening when you're in fight or flight, your highest thinking part of your brain, the neocortex, doesn't work. So when you're running from a tiger, you're not thinking about philosophy. And the human cortex is so big compared to other mammals that when the blood supply drops down in that part of the brain, it really drops down and your thinking centers are markedly compromised and you're just reacting. You're not really thinking. And so since that's so much stronger than your conscious brain, when we use conscious control or conscious interventions to try to counteract that, it's a mismatch. You cannot do it.
This is fascinating. I am so excited to hear you explaining all of this. It's so validating for us going through this, to hear this coming from a physician, from a surgeon, from a medical, a scientific perspective, because it can all sound a little bit woo that, oh, you're in all this pain, or you have a world of symptoms and you have to look at your emotions and, this is your path out of this. So I'm wondering, how many other doctors in your experience are aware of this approach to healing in the latest science and embrace it and use it?
Well, I would say some. I'd say very few surgeons. I would say very, very few surgeons. And I was helping hundreds of patients literally go to pain free. So my symptoms are gone. And I finally figured out the science behind this. And so I translated it into a book and a website, and now a course where people systematically go through and learn the tools to calm their physiology and reroute the nervous system, and the pain resolves. And it happens hundreds and hundreds of times. So I'm watching people being badly damaged by spine surgery with very expensive, long-term, really devastating results from bad spine surgery. I was a guy who was trying to clean up the mess, and it wasn't solvable most of the time. So if I can get to somebody before they had any surgery at all, it was just magical. And I can tell you some stories in a second, but the bottom line is that it's very self-directed. And I don't think I should go too much into the details of the course now because the idea is about learning skills. So what's evolved in the last couple of years is that the body knows how to heal. And that's sort of a trite saying, but it's really true, is that in threat physiology, your body breaks down, right? And if it's sustained, it really breaks down. And then if a weightlifter is lifting weight, he or she has to rest for the muscles to build back up. In other words, overtraining actually breaks your body down. They think if your body's in constant fight or flight, your body's going to break down. So what happens, there's always threat physiology. And again, physiology is how the body functions. And there's safety physiology where the body rests and regenerates and heals. So some ratio of enough safety compared to threat, the body heals itself. So the healing that occurs is far beyond what I can do. It's far beyond a self-help process. And not only do people go to pain-free, usually all the symptoms resolve, and they thrive at a level they never knew was possible. And that happens over and over and over again. So I quit my surgical practice in 2019 because I was so frustrated seeing so many people badly damaged by spine surgery. I'm seeing so many people go to pain-free with minimal cost, no risk, self-directed process. You do not need a pain clinic to do this. I said I had to quit. So that was in 2019. I have not made nearly as much progress as I thought I would. But no, the medical profession is just flat out digging in its heels. That's a long answer to that question, but they're just not buying it. And the thing, can I rant for a second? We learned this in college. Actually, we learned this in high school in the physiology class, right? Temperature, blood pressure, heart rate, all these things were in physiology class. In college, we learned a little bit more. In medical school, we learned about the human body at a very, very deep level. And the physiology is where it happens because the body functions with physiology. It becomes ill when it dysfunctions. So we're focused on structure. And so the problem is, have you heard this term called medically unexplained symptoms by chance, MUS?
Sounds familiar.
Well, it started out in 2002 in the family practice literature. They're saying, well, we know you have all these symptoms. We can't find a source, so we call it medically unexplained symptoms. Well, it's a terrible diagnosis because people give up hope. Okay, they don't know what's going on. The idea of the diagnosis was to acknowledge the fact that you hurt, which is a start, and with nothing we can do, but we can help you cope with it. So that's wrong. Because if we look at the physiology of stress, and again, stress is the problem coming in, you go into fight or flight because of stresses and threats. If you look at the physiology of sustained stress, everything is explained. Every single symptom I had is gone. How can that be? Well, every cell in the body is bathed in this chemical environment. Different organ systems have different functions. So I had migraine headaches. They're gone. Well, what happens is that the blood vessels of the brain get inflamed. The neurotransmitters are off. And when you re-regulate your physiology back to safety, that goes away. My ears were ringing, tinnitus, for many, many years, 25 years. I thought it was from my old construction work days, and I do have some hearing loss, and it's gone. And it's a horrendous symptom. Sounds sort of mild, but the chronicity of it really bothers you. It's gone. And the reason for that, again, I can theorize on it, but it's gone. And lots of people in my course have had their tinnitus disappear. But again, in fight or flight, your nerve itself has inflammatory cells. Your brain itself is inflamed. So it takes less stress to set off the sensations. Then the nerve conduction in your body doubles. So you have a hyperactive ear and receptive system, and your ears ring. My feet would burn like crazy, especially at night. That's gone. Skin rashes would pop up all over my body. That's gone. I had back pain, neck pain. That's gone. So you say, well, how can that be? Well, again, physiology covers every cell in the body. And if you calm down the physiology, all these symptoms disappear. And I had one person, 24 symptoms, gone. Another gentleman had 29 surgeries in 20 years. And he had suffered, it was just a huge mess of his life. And he started working with my stuff about 10 years ago. And in about a year, he went to pain-free. And 10 years later, he's living the best life of his entire life. That's after 28 surgeries. There's two parts to healing. One of them is to learn with your survival physiology, because it's keeping you alive. It's a gift. So anxiety, anger are gifts. I mean, how long would you survive without anger and anxiety? We would not. So you learn to separate your identity from these stress reactions. Is when you take your identity and when you take your stress reactions, which are intended to be very unpleasant, you take them personally, you don't feel good, and you spend a lot of mental energy trying to compensate for this bad feelings, or they're supposed to be bad. So as you separate your identity from these stress reactions, I say, look, just take a thermometer visually on the opposite wall, and when you're feeling really anxious, angry, and frustrated, just visualize how high this thermometer is going and use the tools to drop it down. And so that's one part of it. The other half is nurturing joy. So again, you can't nurture joy if you're fighting stress. Not possible. You can think you are, you can try to distract yourself, but it's such a mismatch, it never works. By the way, if you try to outrun your pain, i.e. stress physiology, you actually reinforce it. So we call it self-induced deep healing, as that you train your brain. Again, it's a trained, learned skill. It's not positive thinking, by the way, which is another disaster. But you sort of train your brain to be less reactive to the pain. As you train your brain to be less reactive, see when you fight it, you really reinforce those circuits. If you talk about it, you reinforce the circuits. So you learn to calm the physiology, and then when you're calm, then you do what you want to do. So the healing actually occurs as you start living your life on your terms, not by fighting the pain. So I have a little saying is quit fighting darkness and just turn on the light. So it's a little bit more complicated than that, but not much. And I'll just give you one example. Well, let me jump to one model here so we can maybe go on to the mental part of the conversation as far as these repetitive thought patterns. But, we came up with a model called dynamic healing. So every living creature has sensory receptors that takes input from the environment. Whatever environment that is, you have the sensory input, and you have touch, sound, sight, feel, all these different sensations. So those come into your nervous system. And so you have your input, you have your nervous system, which processes all this. Then you have your output, which is the physiology, either threat or safety. So there's ways of processing your stresses differently so they have less impact on your nervous system. There's ways of making your nervous system going from hyper-reactive to calm. And then with the physiology, there's things you can do to directly lower the physiology. So on the input side of things, again, the goal is just more safety physiology. So all these interventions come towards one goal. So it's never one intervention that solves the problem. It's a combination of just on day-to-day life using different tools at different times of the day to calm down your physiology. So for instance, let me take one example is if you're in my office and you had chronic pain, I say, look, when you walk around my office, you will never discuss your pain ever with anybody. And because that's input. What's the input doing to your physiology, right? So it goes a little bit deeper than that. Never discuss your physiology. Never discuss your pain. Never discuss your medical care. No complaining, no criticism, no giving unasked for advice, and no gossip. Because what's it doing to your physiology, right? So that's one of the basic cardinal rules is simply no negativity. And often, we used to run some workshops back east, and that was one of our cardinal rules. And it takes about 6 weeks to actually slow that down because we all like to complain. That's just the way we are. And it's sort of hard, especially the gossip part of it. People are used to gossiping. But it fires up your threat physiology, especially when you're in pain. You want to complain about the doctors, the medical system. There's endless things to complain about when you're in pain. And they are legitimate complaints. But do you want your brain on the problem or do you want it on the solution? So just one example of how we work on input. For output, for instance, you probably have done this a lot with your clients where you do breath work, like slow breathing stimulates what's called the vagus nerve, which is anti-inflammatory, or rubbing your forehead stimulates the fifth cranial nerve. Fifth cranial nerve in the forehead. I actually took that little tool for my cat, so I can calm my cat down really quickly by rubbing her forehead. So also sound. There's certain pitches of music that really stimulate the vagus nerve and actually cause it to calm down. And so you lower your threat physiology. And as far as the nervous system itself, you can make it more resilient with sleep is number one. You have to sleep. Diet, an anti-inflammatory diet and exercise are the three big ones as far as the nervous system. So your nervous system can be calm or hyperactive. And sometimes if you come from an abusive environment, you have to teach your nervous system to feel safe. It's like taking a feral cat and trying to calm it down. You can't talk to it. You just have to teach it how to feel safe. So that's sort of the dynamic healing. You have your input or stresses. You have your nervous system or your coping skills. You have your physiology or the output. And we have threat physiology. Then you have symptoms. So the root cause of illness is this interaction between your stresses and your coping skills. So we are treating only the symptoms. So the root cause isn't even being close to being addressed. So it's like trying to put out an oil well fire with a garden hose. The fuel keeps coming up and you've got to go after the root cause. So by dealing with, and so when we teach people to learn these tools, it's about 10 or 15 minutes a day. That's it. We try to really, really learn about pain and really solve the problem. You're actually reinforcing the pain. So you're just learning tools that you use every day, all day long. It should not be work, because one of the antidotes to anxiety is play. And so you take sort of playful, curious attitude towards it. That really calms down the physiology. That's a whole different topic. But anyway, the bottom line is with the dynamic healing mode, you change the input, you increase the resiliency of your nervous system, you learn to lower the threat physiology, then the symptoms resolve themselves. I covered a lot of ground there. I hope it wasn't.
I was just thinking, I think you've covered everything that I've been working to cover on this channel since it started. We might just shut down the channel after today. This is, I think, a mic drop moment. Like you've explained it so incredibly well. And yeah, light bulbs were just going off all over the place. I was even thinking with my own journey for my first couple of years, I was really laid out and really symptomatic. And then I decided for a year that I was going to stop trying to fix myself because I didn't know what else to do. And I wasn't going to talk about it. I made a rule because I was tired of it being my whole identity. And it was interesting. It wasn't the whole fix, but in that year, just by stop trying to fix it and never talking about it again, I started to feel better. So it's just
Absolutely.
one of a zillion little, light bulb moments that were going off for me as you were talking about that. I think, though, preaching to the choir here, as well as to, a lot of the people that watch this channel are pretty read up and up to speed on the science behind this, but still, understandably, many have not been given this information or are just hearing it for the first time. And it sounds a little bit off because I still hear every day from people like, I have all these symptoms. I'm really struggling to believe that I'm going to be able to get rid of them all without surgery or medication. So, what would you estimate? What percentage of chronic debilitating symptoms are alleviated with surgery or
None.
medication? None.
No, you can treat symptoms. Remember, you're treating symptoms. So surgery treats a symptom. And so it might get rid of that one pain in the body. So it took me a long time to figure this out. So let's take back pain. There's not an operation that should ever be done with back pain, ever. Never works. And the reason for that is that, first of all, let's say you have an acute lumbar strain. You strain your back. And about half of people, by the way, this developing a back strain, it goes on to be chronic. So in the MRI scans, what happens is there's a pain center in the brain that lights up for back pain. In about 6 to 12 months, it actually shifts to the emotional center. So you have the same pain, but a different driver. And so the definition of chronic pain is a embedded memory that becomes connected to more and more life experiences, and the memory cannot be erased. And it cannot. These pain circuits are absolutely permanent. It's similar to phantom limb pain, where the leg is cut off. Okay, why is the pain still there? The structure is gone. And so the brain, if you think about this carefully, every living creature has to memorize everything all the time. Otherwise, we don't stay alive. We know when to cross the street. We know when not to look at the sun. We know how to stay safe. But your brain's taking in information every second. So when it sees familiar information, it just ignores it because it's safe. If something new comes up, you have to analyze it. But your brain memorizes everything, but especially pain. And so it sounds discouraging, but the key is the more you try to fight it and solve it, the more you reinforce it. So you have to get rid of the idea that you're going to get rid of these pain circuits so you can walk through them, you can walk past them, you can transcend them, but you can't fight them. And so what you're doing is you learn to separate yourself from your pain. And the first thing that happens, by the way, both with mental pain and physical pain, is that you change your relationship to the pain. And so the pain's here, you're here. As you start getting on with your life the way you want to do it on your terms, that's the solution. And so from a neuroplasticity standpoint, and by the way, neuroplasticity, I'm sure your audience knows, and I did not know this in medical school. I'm not sure we even knew it back in medical school, but your brain changes by the second. We thought that the brain was static and sort of lost cells as you got older, and it changes every millisecond. So even right now, both of our brains have changed. And so what you're doing, you're trying to direct the brain to change the direction that you want. And that's why as you start living the life that you want and you quit fighting the old one, that part of your old brain starts to atrophy. So the circuits are still there. They can be triggered anytime, but they really atrophy to the point where they just don't bother you anymore. So it's consistent. I'll just give you one example right now. Again, I don't know if the audience comprehends this, but anxiety, depression, OCD, bipolar, and schizophrenia are metabolic inflammatory disorders. They are not psychological. So anxiety is just a term we use when you're in fight or flight. So it just describes, humans have this description for fight or flight that we call anxiety, and it's just a descriptive term, and it's not a psychological diagnosis. So you learn to live with it, be with it. I don't like the word embrace it, but you do embrace it because it's part of keeping you alive, and you just go on your way.
We talk a lot here on the channel about the conscious brain and the unconscious brain. So, what is the relationship between those two, and why is it important to understand that when it comes to chronic conditions?
Well, chronic disease is a state. And Dr. Navio at the mitochondrial level has shown that you get a chronic illness, these mitochondria break down and they don't heal. So you have to actually shift that state before you actually can move forward. If you're using acute interventions for a chronic problem, it doesn't work. So what you're doing is learn how to calm down the physiology and then move forward. And I'm sorry, the question was what again?
Just understanding, we talk about some things happened in our unconscious brain and other things we happen in our conscious brain, and we need to bring things from the unconscious to the conscious. Or I think it gets a bit confusing for people understanding the relationship between the two, and how this relates to their symptoms and their recovery.
So the unconscious brain keeps you alive. We do not need a conscious brain to stay alive. So when you use conscious brain, you have to be careful because animals have consciousness also, right? Our animals look at things, analyze, and make decisions, but they don't have thoughts. They don't have language to put meaning to it. So they still respond. And if we did not have a neocortex, we would still stay alive. Chimpanzees have 99.9% of the DNA we do. they do have quite a bit of intellectual capacity, but they don't have this huge neocortex. So remember, the unconscious brain is 11 million bits of information per second. The conscious brain is 40. That's it. So you can't control it. And so it's like trying to stop a dragster with handbrakes. Not going to work. But what the conscious brain does, it gives you the steering wheel. You can steer it and direct it wherever you want. So your unconscious brain will react to whatever you put into it. Again, if you consciously decide to complain or be negative, that's what's going to happen in your unconscious brain. It's going to respond to what you put into it. So it's a 40 bits of information per second compared to 11 million. You decide what you want to load into this thing. And if you want to load in negativity, you have a massive survival reaction. And so the other thing is that this has been known since the 1800s, which I'm really disturbed about. I just found this out a couple of weeks ago. But if you see somebody dangerous walking across the street, your body actually responds first before you have thoughts. It's the actually physiology first. So it's about a 1 to 10 second delay from your body automatically reacting by the time you think about it. So let's talk about thoughts for a second. I'm writing a new book on repetitive unwanted thoughts. And so what I've learned in my own experience is that I have full-blown obsessive compulsive disorder, which is marked by really extreme intrusive thoughts. And most people don't have that. But just by definition, the way the brain works, and this is where I think humanity's got to come up with this different solution for this, is that your threat physiology creates unpleasant thoughts. Because what happens, the conscious brain is interpreting the sensations made by your unconscious nervous system. We call it interoception. So if your body's in fight or flight, your conscious brain gives different meanings to these sensations. And, there's an endless number of negative words, sad, shame, embarrassed, all these different things are meanings we give to a physiology. So the way your brain is working is that your physiology creates these unpleasant thoughts, but then the thoughts themselves become input that actually strikes up the physiology. This is very bidirectional. And so after a while with repetition, the thoughts become embedded and different triggers always fire up the physiology and vice versa. So if you're anxious or frustrated for any reason, you can fire up negative thoughts, but then the negative thoughts can also become their own input. So that's one part that's bidirectional that's very unique to humans. So with repetitive unwanted thoughts or ruminations, why 95% of people have these things. And about 70% of people have them at a level that disrupts their lifestyle. I had the extreme form, which is only about 2 or 3% of the population of extreme intrusive thoughts, really negative. And with all the physical symptoms I had, the two worst parts of my ordeal were these repetitive thought patterns. They were just horrible. By the way, there's also a direct relationship between ruminating thoughts and suicide. I actually attempted suicide and missed this whole thing. And what drove me to that was the thoughts. They just would not stop. So I noticed over the years that people's pain would disappear, their anxiety would drop, and these thought patterns kept spinning away. So fortunately, in my experience, they actually disappeared. They're gone, but I couldn't figure out why. And so what you have to understand is that there's a 4-part process to solving these thoughts. So the metaphor I like to start with is that of a hornet's nest, where the nest represents your nervous system or your brain, and the hornets represent your thoughts. And if somebody shakes the nest, the hornets are pretty unhappy. And so what we're doing, we're outside fighting these hornets, which is making them more angry. And the real answer is quit shaking the nest. So the 4 parts of solving these thought patterns is, number 1, separate from the thoughts. And that's where mindfulness, cognitive behavioral therapy comes into play. Have you heard this exercise called expressive writing? Have you worked with that much? So that separates you from the thoughts, not solving them, just a thought separation process. And then the nervous system, so the first step is separate from your thoughts, calm the physiology. The third part's dissolve your ego. And the fourth part's neuroplasticity. So the thought separation is the first part where you learn to express them, look at them. Mindfulness does the same thing. You simply, the thoughts are here, you're here. And then calm physiology is this dynamic healing model where you're changing the input, the nervous system, the output. And what you're doing is mostly around anger. So people are angry about a lot of things. They always have been, particularly in this day and age with a lot of sensory input. We're overwhelmed, we're frustrated, we feel trapped. And when you're angry, your nervous system is really fired up. So there's a bunch of tools of, I call it anger processing, to calm things down. is sort of beyond the scope of this discussion. But calming physiology down is absolutely critical. So physiology drives the thoughts, and in medicine, we're not addressing the physiology. So we're doing an endless number of cognitive processes to deal with these thoughts, and we're not even addressing the root cause at all. The third part, which is maybe beyond the scope of this discussion, that we develop an ego for a couple of reasons. One of them is our stress physiology is unpleasant, makes us feel bad. So we develop this story about ourselves to feel better about ourselves. Second of all, we're mostly programmed by negativity, right? I mean, that's a lot. We're raised by criticism. Do this, shouldn't do that. So we're sort of programmed throughout our lifetime with negativity. So we develop our own internal story about ourselves to feel better. And then the third reason is we're a competitive species like every other creature. So we want to look good. So we spend a lot of time building up this appearance to other people, but also to ourselves to look good. It takes a lot of mental energy to do that. So on top of that, we suppress negativity. So the suppressed thoughts and emotions really fire up this whole process of ruts. And then it develops into what we call mental rigidity, which is cemented in by anger. You get this really fixed view of yourself. It's not solvable. That's where conspiracy theories come into a big play. You get these thoughts about life in general, that this, and this. So rigid thinking is a huge block to healing, is a huge block to treatment. Because you get a certain mindset and it's not changeable. So that's the challenge we deal with now, is that if you're open to actually engaging, people heal. But the key issue is people don't believe it. You mentioned earlier, well, what if you talk about this and people don't buy into it? Well, it's a problem. So I ask people, don't believe me. Don't. So when you leave this podcast or TV show, don't believe anything I said. The key is connect to what's in there, which is skepticism. So I said, you don't have to believe anything in David Hanscom or the process or whatever it is. Believe that your body knows how to heal. So connecting with what is a huge factor. And so connecting with your skepticism is actually the starting point. Then you start doing the work, and then letting your brain start to change. And then the fourth part, where the healing actually occurs, we talked about this before, you separate from your physiology over here. But as you nurture joy, good food, good wine, good friends, your brain develops that direction. That's the definitive healing. It's not by fixing the negative side, it's by nurturing the good side. So with these thought patterns, you've got your thought separation, call the physiology the driving force. The third thing, which has to happen relatively quickly, is kill your ego. You don't need it. If you understand your physiology is over here, you're not taking it personally. You don't need an ego. It's a waste. Think about it. Think how much time we spend, with me being king of this, how much time we spend building up an appearance that we think is okay. So that takes mental energy that my cat doesn't spend time with. So, she just gets what she wants anyway, so she doesn't need an ego. So, that goes.
So I'm thinking about the people listening, watching, and I think there's a tendency for people to think I'm somehow going to be the one person that this doesn't apply to. So for people who learn what this is about, who implement the strategies, who follow this course of moving forward, I mean, what percentage of people would you estimate that this could be beneficial for people with these chronic symptoms?
Well, I'll tell you that I don't know. All I know that depends on just repetition. So it depends how committed you are to learning the skills. So the focus is on the skills, not believing. So you just learn how to calm your physiology and let your body heal. The hardest part of this project by far is people can't help but try to fix themselves. And when you do that, of course, your attention's on the problem. So you learn to be with the problem and then move a different direction. So if people engage, it's a high percent heal. But it may take a week. Usually, I would say between 3 to 6 months of repetition is the key issue here. And it takes a while to learn how to play the piano. It takes a while to learn how to become a professional at anything. And people might say, well, I don't want to become a professional. Well, really? I mean, you're basically becoming a professional at life skills. So we're not being the highest level professional, learn how to regulate your physiology. So I'll just give you one example. I mean, I have a lot of people who are there. The thought patterns are a little bit something I'm learning. I mean, it's really tough to break through these thought patterns. But as far as the pain and anxiety, that can drop down relatively quickly. I'm on a learning curve as far as these thought patterns. But I had one gentleman who I saw a couple months ago. He's a friend of a friend. And I'm not in clinical practice, but I can give guidance. So he was having surgery recommended on a normal spine. It was like a long spine fusion. And turned out he was suicidally depressed. So the data is shown forever. Again, the whole process evolved of just by trying to follow the research about what we're supposed to do. So none of this is something I made up or invented or some magic formula. It's just following the science. So the data, even if I didn't know any of this clear back 40 years ago, you don't operate on people that are suicidally depressed. You just don't do that. Well, that's being done all the time now. And so that operation in that circumstance would have done him in. And this is what I saw in my practice. So we started the process that I'm working on about 6 weeks ago. I talked to him a couple days ago. His mood is way better. Depression's lifted. He's not suicidal. The pain is still there, but he doesn't react to it so much, which is always the first thing that happens with pain, that it's there, it doesn't bother you as much. Eventually, as you keep going a different direction and forming new circuits in your brain, those new circuits don't have pain. So people do go to pain-free, and it's been a repetition and learning tools. But again, we call it deep self-induced healing. If you allow your body to be in a state of physiology, your body heals itself. So this might be confusing, but I'm going to try anyway. There's a concept of self-help versus deep healing. So self-help helps symptoms, and it can contribute to deep healing. But if the idea of self-help is I'm going to learn enough tools, I'm going to be really good about processing pain because I want less pain, the pain's running the show. So inadvertently, self-help processes tend to reinforce chronic pain. So deep healing is learning to not react to the pain, be with the pain, and then go a different direction. So letting go of the fixing process is really challenging. That's probably the biggest step, is letting go.
Yeah, this is incredible. I'm just thinking this is a lot of information for people watching, listening. So if you're feeling like, I think maybe I retained 10% of that, don't worry, watch it again. I'm already thinking I'm going to have to go back and replay this. And I'm wondering what resources, what information, what do you have available for people who want to learn more about this from you and get some support on their journey?
So all my resources are on my website, backincontrol.com, one word. And then on the front page there's a lot of resources. We put up some flip books, which really give some nice summaries of the situation, just to really get a simple start to it. I have a book, Back in Control, A Surgeon's Roadmap Out of Chronic Pain. And then I have a course called the DOC Journey, Direct Your Own Care Journey. It's a computer-based course. And I recommend people spend maybe about 10 or 20 minutes a day on it. That's it. It shouldn't be work. It should be curiosity, what's going on. Look at it as just learning skills. It's very self-directed. Then I coach twice a week on Tuesdays and Thursdays at noon on a Zoom call. And so the coaching by itself is not effective, but if you add the coaching to the course, it's very effective. And so then I have all sorts of videos and blogs and probably too much stuff on the website. But the core between the flip books, the course, the coaching is sort of in the book, Back in Control, get you started on what you're going to do.
Incredible.
Yeah.
Okay, we'll make sure to have that all linked in the video description so people can check it out, because you have hit the nail on the head for all the key things that the experts that I bring on this channel talk about, and explained it just all so concisely. So for people watching, listening, do yourself a favor, take a moment, look at some of those links, because he's got the experience, the knowledge, and clearly a wonderful person. So some really great resources there to make use of on your journey. And I'm also going to link, if you're watching this and this is resonating, I did another interview with Dr. Howard Schubiner, you might be aware of, so I'll link that up on the screen as well if people want to check that out. It's just really incredible and really validating to have so many knowledgeable physicians coming forward and speaking about this, and just validating the experiences of people going through this. Because for many years, so many of us felt lost and were told it was all in our head, or we were just being lazy or maybe making it up. So this is impact, just not only the validation, but also tools, a path forward. You can get better.
So
Thank
by
you
the way,
so much.
Howard Schubiner is a good friend of mine. He's my mentor.
Oh,
So we,
incredible.
we play golf together. We stay at each other's houses and stuff. So no, he's wonderful. He's very academic. He keeps doing the research on it, and he's really, really wonderful.
Yeah, I've only interviewed him the one time, but I just thought the world of him, and he is another one who is just really changing so many people's lives. It's incredible the work that people like yourself and him are doing. Thank you so much for being here. I really appreciate this. Every sentence of this has been gold. Truly valuable. I really appreciate it, Dr.
Yeah,
Hanscom.
thank you. I really enjoyed our time.
Thanks to everyone for watching and listening. I hope to see you in this next, also incredibly information packed interview with Dr. Howard Schupner.